Hi friends. Today we are going to discuss about clinical laboratory. In general, matters of universe can be subdivided into two main categories. 1. Live. 2. Alive. Live can be defined as a matter which has simultaneous predefined chemical reactions in a proper order. If the chemical reactions are proper, there will be no problem. In case anything affects the proper order of chemical reaction, some illness will occur. Abnormality can be analyzed by the clinical laboratory. Causes for the same will be abnormal nutrient intake or exposure to pathogens or toxins or rays, and sometime it may be a genetic problem. Whatever may be the cause that will lead to make an illness to the matter. If we encounter such illnesses, we will meet physician to get well. There are some physical examinations he or she will prescribe, some investigations, for example scan, X-ray, clinical laboratory test, and some others. Upon these lists we are going to see about the clinical laboratory in detail. There will be 3 phases of process in the clinical laboratory. 1. Pre-analytical process. 2. Analytical process. 3. Post-analytical process. Pre-analytical process will start with patient entry and end with quality control, as in this slide. Patient entry details may be varying from one lab to another. This is simple, a template that contains some information that are very essential to be included in the patient entry register. Next, instruction of patient before starting next process is mandatory, hence the patients may not know about the process of laboratory. The instruction must contain the points that are given in this slide. Sample collection is the process where we are going to take or receive samples from the patient. The sample lists are given here. Process for the collection is wide, so we will discuss it in a separate video. After collection of sample, that sample will be stored in a proper container and keep that in a refrigerator if required. And labeling with patient, it is mandatory. If the container having anticoagulant, mixing of sample after addition to the container will reduce the sample error. After the above process, the sample would be centrifuged in case we need serum as a sample. If the test is going to be tested by another laboratory before transportation, all the process mentioned above have to be completed. Ice pack may be required, that will be depend on the sample, test and distance. Anyway, packing with ice pack is good practice. As per the instruction from the machine manual, engineer's instruction, maintenance must be completed on time, which will increase the life of that particular instrument, and report taken from that instrument will be excellent. And before starting each shift, quality control must be done. If the quality control in range, we can start the test, otherwise start the error solving actions. After getting normal range only, we can start the test. Quality control itself take more time, so that will also be published in a different video. Analytical process is a single-step process, but the main process where testing of sample will occur. There is lot of testing in the sample. We will discuss each test in a specific video. After analysis, post-analytical process will start as mentioned in this list. Report tying is the process of presenting the report in an easy readable format. This is a report template that contains the details which are very essential. After typing, report must be verified by a qualified staff before dispatch. Finally, all the reports and details to be maintained as registers for further reference. By this I end this video. If you like my video, hit the like button. If anything you want to discuss with me, comment. Finally, don't forget to subscribe. Thank you.